We are ready to get started. I'm going to turn it over to Michelle to welcome everyone.
Yes, thank you, Sari. I appreciate the introduction. Welcome to the June Town Hall for the Community Support Waiver. This discussion today is going to be led by Sari and Jackie Mary Weber. So I will turn it back over to them to get the discussion started. Thank you.
Thanks, Michelle. Next slide. So our agenda for today, we started with the welcome. Then we're going to discuss Appendix E, self-direction. After that, we're going to provide some updates to Appendix G, and then we'll wrap up with some future meetings. So next slide. Jackie, I'm going to hand it over to you to start your self-direction conversation.
Thanks, Sari. All right, so I'm going to talk today all about Appendix E of the waiver application, which is about self-direction. So feel free to go to the next slide. Okay, so what is self-direction? When a person chooses to receive services through the community supports waiver, they can choose to receive either provider managed or self-directed services. Self-directed services allow the person to manage all aspects of service delivery, including recruiting, hiring, supervising, or firing providers, scheduling their services, and deciding how much of their budget they'll pay for a service. So self-direction really promotes personal choice and control over who provides services and how they are delivered, and it has been shown to promote positive outcomes for individuals, improve participant satisfaction, and be cost effective. Next slide. So CSW participants can choose between two types of self-direction: employer authority or budget authority. If a person chooses to use employer authority, they can employ their own providers, meaning they would hire the provider, train them, supervise them, and fire them if they aren't satisfied with their performance. And then if a person selects budget authority, they can manage their CSW budget and make decisions about how much of their budget they'll use to pay for each service included in their person-centered service plan. Participants can choose to use employer authority, budget authority, or both. It's pretty common for participants to use both employer authority and budget authority in combination. And then in the blue boxes on these slides, I've highlighted what things will be different on the CSW compared to the IDD waiver. So the IDD waiver only allows people to use employer authority. Using budget authority and managing their budget will be unique to the CSW. Next slide. So this slide goes into more detail about what a participant can do when they choose to use employer authority. So when using employer authority, the participant is the common law employer of the workers who provide the waiver service. This means they can recruit, hire, and fire staff. They'll verify staff qualifications and ensure background checks are conducted. They'll orient and instruct staff in duties. They'll supervise staff and evaluate their performance. They'll determine staff wages and benefits subject to state limits, and they'll verify time worked by staff and approve timesheets. Next slide. Participants can use employer authority to hire workers to provide personal care services, family caregiver support and training, respite, and/or non-medical transportation. Next slide. On this slide, I've gone into more detail about what the participant can do when using budget authority. So I won't read every bullet point for the sake of time, but generally with budget authority, a participant can reallocate funds among services included in the budget. They can determine the amount paid for services within the state's established limits. They can identify service providers and refer for provider enrollment, and they can authorize payment for waiver goods and services. And participants can use budget authority for all CSW services. So participants accept significant responsibility when self-directing their services. So there are a number of supports available to assist them with self-direction. The first being their MCO care coordinator and targeted case manager. During the service planning process, the MCO care coordinator is going to provide information to participants on the benefits and risks of self-direction so they can make an informed choice on if they want to self-direct their services. And for those that do choose to self-direct their services, a financial management services, otherwise known as the FMS agency, will help process payroll and taxes on behalf of the participant and track their budget expenditures. Self-directing participants will also have a support broker to provide ongoing assistance. The support broker is going to provide an orientation training to the participant, help them develop a spending plan, teach them how to recruit and hire staff, and how to be an effective employer. Support brokers are not currently available on the IDD waiver. This extra support will be unique to the CSW, and having support brokers was something that was included in the legislative language directing KDADs to develop the CSW. So that's why they are included on this waiver. Next slide. So this slide details the responsibilities of the FMS. The FMS agency will help participants verify that workers meet the required provider qualifications and ensure that background checks have been completed according to KDAD's background check policy. They're also going to collect and process the timesheets of the participants' workers. They're going to process payroll and do all of the withholding, filing, and payment of applicable federal, state, and local employment-related taxes and insurance. They're going to maintain a separate account for each participant's self-directed budget and track and report on the balance of participant funds. They're going to process and pay invoices for goods and services approved in the person-centered service plan, and they're going to provide the participant, the MCO, and TCM with periodic reports of expenditures and the status of the self-directed budget. Next slide. The FMS is also responsible for executing provider agreements, maintaining a participant portal that enables online access to current expenditures and budget status, orienting participants on the responsibilities and processes for self-direction, and connecting participants with support brokers who provide ongoing information and assistance to self-directing participants. Next slide. So now we'll go over the responsibilities of the support broker in more detail. Support brokers provide education and training to participants on the participants' responsibilities, rights, and risks when using self-direction, understanding their role as an employer, including how to recruit, hire, and terminate workers. The support broker is going to train the participant on the required qualifications for providers, including the background check requirements. They're going to help the participant identify topics for and conduct their worker training. They're going to help the participant know how to manage their service schedule and develop backup plans to ensure that their services continue if their hired staff member becomes unavailable unexpectedly. They're also going to train the participant on the electronic visit verification system, which is called EVV, and also the timesheet approval process, and how the participant can access information on their budget balance, and then the consequences of fraud or misuse of program funds. So when the support brokers are training participants on all of these items, they'll make sure to personalize the training to make sure that the information is specific to the participant's circumstances. KDADS plans to contract with one FMS agency to support all CSW participants who are self-directing their services. KDADS is going to select the FMS agency through a competitive bidding process. And the supports provided by the FMS and the support brokers are set up on the CSW as administrative activities. So that means that they're available to all participants self-directing their services, and KDADS pays for them through administrative funds. So that means that a participant doesn't have to use their CSW budget to pay for any of the support that they receive from the FMS agency or support broker. So this is different than how it currently works on the IDD waiver. FMS is set up as a service on the IDD waiver, so that means that there's multiple service providers offering FMS services, and the money is paid out like all of the other waiver services. But setting it up as an administrative activity saves the CSW participants' budget from being deducted. Next slide. So participants can choose a designated representative to direct their services. The designated representative could be a legal representative, such as a parent or a spouse, or a non-legal representative, such as a friend or family member that they trust. If a participant uses a designated representative to direct their services, the participant can decide which responsibilities the designated representative will perform. For example, they could decide that the designated representative will recruit, hire, and supervise their employees, or manage their self-directed budget, etc. The participant's person-centered service plan will document the role and responsibilities of the designated representative, and the FMS agency and the support broker will recognize the participant's chosen designated representative as a decision maker and provide the same orientation and support to the representative as they would provide to a participant. When a participant decides to use budget authority, they take on the responsibility of managing their budget. And the budget is determined by the services that are included in their person-centered service plan. So the cost of each service is going to be calculated by multiplying the rate for the service by the number of units authorized in the service plan. And then the costs of each of the services are added up to get the total budget amount. A participant's self-directed budget amount cannot exceed the $20,000 annual limit established by the legislature for this waiver. And the MCO care coordinator will be responsible for sharing the budget amount with the participant if they choose to use budget authority. Next slide. If the participant uses budget authority, the support broker will help the participant create a monthly spending plan to document how much of their budget they want to allocate to services and when they'll receive services each month. The MCO care coordinator will review and approve the participant's spending plan. If the participant believes that their self-directed budget amount does not meet their needs, they can request an adjustment to their budget through their TCM or their MCO care coordinator. The MCO care coordinator has the ultimate authority for adjusting the self-directed budget amount and updating the person-centered service plan to reflect the participant's assessed needs. Next slide. Okay, perfect. So there are some budget safeguards in place to help participants manage their budget. The FMS agency will provide monthly and quarterly financial reports to the participant, their support broker, their TCM, and their MCO care coordinator. The support broker will review the monthly financial reports from the FMS for the following. So they're going to look for underspending. Underspending occurs when the individual spends less than 80% of what was authorized for the month, unless they were hospitalized or there was another reason for low spending. Support brokers want to know if there's consistent underspending to understand why this may be and to follow up with the participant to ensure they're getting the services that they need. Support brokers are also going to review the financial reports for uneven spending. So uneven spending occurs when the hours for a participant's employees are being used disproportionately. So for example, if the employee is working 75% of their time in the first 2 weeks of the month versus 25% in the last 2 weeks, this uneven spending may indicate that a conversation needs to happen with the participant to ensure they're getting all the services they need throughout the entire month, and to see if they need any additional support in identifying more staff to fill in the gaps during the month. The support broker is also going to double check to make sure that the participants' employees are not being paid additional hours over what is expected in the spending plan. And they're going to look for turnover. So if turnover is consistently high, it could mean that the participant needs some additional support when hiring and managing their staff. The other thing that they're going to look for is excessive use of agency services. So if a participant is consistently having gaps in their staff availability and using agency services to fill those gaps instead of having sufficient backup staff in place, then the support broker may need to follow up with the participant and provide support to help them identify who can cover services when their worker is sick or takes vacation, etc. So, voluntarily stopping self-direction. A participant can decide at any time that they want to stop self-directing their services. They do have to give 10 days notice to the FMS agency and the MCO care coordinator to allow time to set up provider managed services. So the MCO care coordinator will then alert the TCM and the CDDO of the participant's decision to stop self-directing their services. The CDDO will assist the participant in making an informed choice of new service providers, and the MCO care coordinator will update the participant's person-centered service plan as needed. The TCM is then going to facilitate transition meetings with the participants' newly chosen service providers. The MCO care coordinator may recommend that KDADs discontinue a participant's opportunity to self-direct one or more of their services when, in the MCO's professional judgment and as observed and documented in the participant's case file, one or more of the following occur and it's not resolved through further training or remediation efforts. So if the participant or their designated representative consistently fail to fulfill the responsibilities and functions required for self-direction, then the MCO could recommend that KDADs discontinue self-direction. If the health and welfare needs of the participant are not being met based on documented observations by the MCO and KDAD's quality assurance staff, or if there's some sort of confirmation from Adult Protective Services. If the participant's hired provider has not adequately performed services or the necessary tasks for self-direction, and all attempts to remedy have been exhausted, including replacing the provider, or if the participant has 3 or more occurrences over 12 consecutive months in which they utilize services at 80% or less of what is stated in the spending plan. If the reason for the consistent underusage is due to provider capacity issues, a referral will be made to the MCO to help resolve the issue. No adverse action to the participant's ability to self-direct will occur because of a provider capacity issue. But in other cases where it's not a provider capacity issue, the MCO could recommend that KDADs stop self-direction. Next slide. Additionally, if the participant, their designated representative, or their hired service provider has abused or misused self-direction, including directing the hired provider to deliver services beyond the scope of the service definition, beyond what is included in the person-centered service plan, or beyond the limitations of the provider's training, or if they are submitting signed timesheets for services beyond the scope of the person-centered service plan, then the MCO care coordinator could recommend stopping self-direction if additional training doesn't resolve the problem. Next slide. There are a few situations in which self-direction could be removed by KDADs without a documented attempt to remedy the issue with further training. Those circumstances include if the participant or their designated representative falsified records that result in claims for services that were never delivered, if the participant has health maintenance activities or medication set up, and the participant's attending physician or registered nurse no longer authorize the participant to self-direct that care, or if the participant and their designated representative have committed a fraudulent act. Next slide. Okay, so here I just have a summary of the process for starting self-direction. Again, self-direction is optional for CSW participants. It's not required. So first, the MCO care coordinator is going to inform the participant about their option for self-direction when they're creating their person-centered service plan. Then the participant is going to make a decision on if they want to self-direct some or all of their services. If they choose self-direction, the MCO care coordinator is then going to connect the participant to the FMS agency. The FMS agency will connect the participant to a support broker who will provide an orientation for the participant and help them create a spending plan if they choose to use budget authority. The participant will then work to recruit and hire their workers with the assistance of the support broker as needed. The FMS is then going to assist with all the paperwork, such as confirming the background checks, confirming the provider qualifications, and establishing a provider agreement. And then self-directed services begin. And ongoing monitoring will occur with the support broker providing support and training to the participant as needed along the way. Okay, so I'm going to pause here and open it up to questions on self-direction. So Peter, if you don't mind helping me manage the Q&A.
Absolutely, Jackie. Thank you for running through all that for our guests. As we said at the beginning, if you have any questions, please do add them in the Q&A. You can see that at the bottom of your Zoom screen. If you'd like, you can also send feedback, questions, comments, anything like that after the fact to kansascsw.com. If you just visit that website, you will see our feedback form. You also have the chance to join our mailing list. I assume most of you have already, but if you haven't yet, that's another great way to stay up to date on what's happening with the CSW. So, Jackie, while I've been talking, we have had one question. I'm not sure if this is necessarily around self-direction, but I'm going to throw it to you anyway. Cindy Fisher is just asking if CSW funds can be used to pay for assistive technology.
Yes, assistive technology is a service on the CSW. So if assistive technology is included in the participant's person-centered service plan, and they are self-directing their services, they can use their budget to pay for assistive technology.
Jackie, we're getting some more questions. The second one is from an anonymous attendee. Would somebody under the waiver be allowed to designate an employee of a service provider to be their representative specifically for FMS or support broker service?
A good question. Okay, so would it be allowed for the person to designate an employee of a service provider to be their representative as it pertains to the FMS support broker service? Well, I hope I'm answering this correctly, but if I'm not, anonymous attendee, feel free to ask another question about it. So the FMS and the support broker service, that's the FMS entity is going to be selected by KDADS through that competitive bidding process. So the FMS will not necessarily be chosen by the participant. It's going to be contracted with KDADS, and you won't get to pick who your FMS is. For support brokers, the FMS is going to employ the support brokers. So you can get a support broker through the FMS. But I think your question then is about like if you want to have a designated representative. So that would be separate from your FMS and your support broker. Your designated representative could be anyone you choose as a participant. So it could be your parent, it could be a friend or family member that you trust. And they could also like provide services for you. So I don't know that if you're specifically thinking like somebody works at a agency and they provide you with some personal care services or something and you want them to be your designated representative. I'm not sure. I think you'd have to look into the specifics of that, but I hope that resolves your question of how your designated representative who you've chosen to maybe hire or manage your budget is different than the FMS and the support broker.
Jackie, I'm going to bounce to a later question quickly because I think it's related to what you just said. Vicky Seams is asking if there could be a potential conflict of interest in that choice. I imagine that choice being picking a service provider as your representative.
So you can, yeah, and maybe I need to take this back and discuss it more internally of the conflict of interest of like say you're a parent directing the services, but you also want to be the provider. So I can maybe look into that further and get more information on that.
Thank you, Jackie. Yeah, we appreciate you trying to answer these questions in real time. For everybody who's interested in this particular subject, we'll make sure you get an update either through the CSW website and or as part of the next town hall we hold. I'm going to stick with you for a little while, Jackie. So where does the TCM fit into the process of starting self-direction?
The TCM will be involved likely in the service planning process at the beginning when the participant is creating their person-centered support plan and their person-centered service plan and deciding which services they'll access on the CSW. The TCM could give participants information on their option for self-direction and talk them through the process. The MCO care coordinator can also do that as well. And then the TCM, likely will know who the FMS entity will be and can work with the MCO care coordinator to connect the participant to the FMS if they do want to start self-direction.
Jackie, and who pays the support brokers?
KDADS pays the support brokers via administrative funds. So that will be established in their contract with the FMS entity. The FMS entity then employs the support brokers and pays them their salary.
Jackie, and this next one might be a suggestion for us rather than a question, but I'll give you a chance to weigh in on it as you can. If only one excuse me, keep having trouble with that acronym. If only one FMS provider is used, would that limit choice for the self-directed consumer?
Yeah, when you're comparing like the IDD waiver, there's a lot of different FMS providers that you can pick from. But for the CSW, right, you won't have a choice of which FMS provider you're using. It's just going to be the one that the state contracts with. If that does become a concern, KDADs could decide in the future to contract with multiple FMS, but the plan for right now, seeing as this is a new waiver and they're piloting this, that they'll just use one FMS for now.
Thank you, Jackie. An anonymous attendee, if this is something you feel strongly about that should be adjusted in the waiver, you have ample opportunity to provide us with that suggestion. Like I said, you can go to kansascsw.com to just send us something, and then there will be a public comment period once the waiver is a little bit closer to final, where you'll be able to explore the sections and provide some feedback on them. This next question is, Sari, this might be for you or for Michelle. This one's from Elise Mercer, asking if the number of unduplicated waiver slots has been finalized. I assume in this case, unduplicated means unique to the CSW as opposed to crossed over with the IDD waiver or some other waiver program.
Thanks, Peter. We covered this in the last town hall, so I will quickly give the numbers here, but we'll post the slide deck to the last town hall for folks to go and look at the slide deck itself. But so for waiver year 1, it will be 500. For waiver year 2, it will be 1,000, and then waiver year 3, it will be 1,500. So we'll post that a link to the slide deck where you can look at those numbers further and follow up with any questions.
Thank you, Sari. I just posted that in the chat. So as Sari said, if you want a little closer dive into those numbers, you can feel free to explore that there. And if any questions come up as a result, as I've said over and over, feel free to email us at your leisure. Sari, while I have you, I think this one might be a little bit wider as well beyond self-direction, but whoever has the answers, I'm all ears. Danielle Parsons is asking if the budget will look similar to the one used for working healthy /work.
I think I can take that one. So I think what Danielle is meaning is when the budget for if you're self-directing your services. I know that Working Healthy and Work also offers some of that like self-direction. I don't know enough about what the specifics of the budget looks like for that program to provide a yes or no. Michelle, do you know any more about the specifics of if the budget you think will look similar to Working Healthy or Work?
Yeah, we're going to look at Working Healthy or Work's budgets and see if that's something we can use. We just haven't got into it very far at this point. But we'll certainly take a look at them and how they develop their budgets and see if we can use anything from there.
Thank you, Michelle. That gets us through all of the open questions in the QA right now. So with that, why don't we move on? And if anybody else has questions on self-direction, feel free to add them, and we'll circle back as we have time at the end.
Thanks, Peter. So today I have some updates that I want to discuss with you all about Appendix G of the CSW, which covers participants' rights. So next slide, please. So the updates I have for you concern 3 requirements that CMS lays out for this section of the waiver. First, I have some updates for you regarding the language around behavior management committees, also known as human rights committees. These updates are in response to CMS requirements concerning the protocols for authorizing the use of restrictive interventions and restraints, including treatment planning requirements and review reauthorization procedures. Next, I have some updates about the training requirements for CSW providers. These updates correspond to CMS requirements concerning the required education and training of personnel who are involved in the authorization and/or the administration of restraints and/or restrictive interventions. And then finally, I have updates about MCO oversight responsibilities in order to address CMS requirements concerning state oversight responsibility for monitoring and overseeing the use of restraints and restrictive interventions. Next slide. So I'm going to start with some updates to the BMC requirements. So all waiver participants with a restraint or restrictive intervention in their behavioral support plan will need to have the plan reviewed and approved by a behavior management committee. This includes participants under the age of 18, participants residing in the community, and participants who are self-directing their services. Next slide, please. For any restraints or restrictive interventions added to a participant's plan, TCMs must document the risk. Sorry, I think I skipped. Oh, sorry, my fault. TCMs must document the risk of harm versus the benefits of harm reduction in the behavior support plan. BMCs and care coordinators must review and approve this assessment. This requirement clarifies and builds off language in Article 63, requiring that voluntary informed consent has been obtained from the person or the person's guardian if one has been appointed, after review of the risks, benefits, and side effects as to the use of any restrictive interventions or medications. Next slide. Next, I will turn to updating the training requirements. KDADS plans to require that provider types of the following services be required to receive training covering restraint, restrictive interventions, crisis prevention, including positive behavior supports and crisis intervention. So those services, those providers of those services is behavioral therapy, non-medical transportation, career exploration and planning, occupational therapy, family caregiver support and training, personal care services, individual employment support, physical therapy, life skills services, respite, and speech and language therapy. So for the provider types for the following services will not require the training: assistive technology, medication reminders, benefits planning, personal emergency response systems, home and environmental modifications, remote support, home telehealth, specialized medical equipment and supplies, individual directed goods and services, and vehicle modifications. Next slide. KDADS will approve these trainings in advance in writing. KDADS plans to approve established training programs such as MNAT and CPI, as well as agency-developed curricula that cover the required topics. Provider agencies that prohibit the use of restraint by agency staff will not be required to provide restraint trainings. These agencies may submit their policy prohibiting restraint instead of proof of a training covering restraint. These agencies will still be required to provide training on restrictive interventions, crisis prevention, and crisis intervention. Individuals who self-direct their services must specify any provider qualifications, including training requirements that they think are necessary. Self-directed providers will not be required to receive trainings on these topics unless required by the participant. Next slide, please. Lastly, regarding training requirements, KDADS is currently updating the trainings required for TCMs. The updated training will include material on restraint, restrictive interventions, crisis prevention, including positive behavioral supports, and crisis intervention. Next slide, please. So for MCO oversight updates. So finally, I have an update for you about the MCO oversight role. MCOs are responsible for ensuring that all waiver providers meet any waiver requirements before providing services. As part of this responsibility, MCOs must confirm that providers have completed a KDADS-approved restraint, restrictive intervention, crisis prevention, and crisis intervention training in the last year, except again for those employed by agencies who prohibit the use of restraints, who are not required to complete a restraint training. Any errors report concerning the use of restraints or restrictive interventions will include investigation by the MCO as to whether the provider had completed the required training within the last 365 days. Next slide. So now I'll pause here for any questions about these updates.
Thank you, Sari. So far, we only have one. This one's from Colleen Hunter, asking about BMC. I don't know if this is a question for a clarification on the acronym itself, or there was a typo on a particular slide, but why don't we just start with saying what BMC stands for?
So BMC stands for Behavior Management Committee, which is, I see in the question, it's also about asking about the Human Rights Committee. So those are the same. So the HRC is the Human Rights Committee, the BMC is the Behavior Management Committee. They can be interchanged, that terminology.
Perfect. Thank you, Sari.
We can also open it up to if anyone has any other questions regarding self-direction or any other questions for the CSW.
As we wait for more questions too, I will do my usual plugs. We post copies, recordings of the town hall and slides on kansascsw.com, so you can always go back and review it there. As I said, from the website, you can also fill out the contact form to reach us with any questions, comments, concerns, feedback. We'd love to hear from you. And also, like I said, sign up for the mailing list if you haven't yet. If you have and you think somebody else might be interested in it, feel free to forward them the link as well. We're happy to put as many people on there as we can. So with that, as Sari said, we'll throw it open. Any questions on any topics from today's town hall or just the CSW in general? We are more than happy to answer every question you have. Yeah, absolutely. Anonymous attendee. We can post a link in the chat. As I said, that's just kansascsw.com. Make sure I spelled that right.
I think we can give it another 30 seconds, and then, as Peter said, you can, if you have any other questions, you can always send it to us through email or a feedback form. Okay, let's go to the next slide. So just wanted to remind everyone of our next town hall. It will be Wednesday, July 23rd from 2 to 3 p.m. I see that another question has come in that says these changes are expected to begin in 2026. Yes, that is the case. So the goal will be to go live for the CSW. I think it's spring or summer 2026. I don't know, Michelle, if you have a more specific date that you would like to share.
Sherry, I'm sorry, a specific date for what?
It says, the question is, these changes are expected to begin in 2026. And I said that the CSW will be going live spring, summer 2026, but I didn't know if you had a more specific date that you would like to share.
Yeah, we're aiming for the, early summer 2026, but there are some factors we do not control, such as, how long it takes CMS to approve the waiver and, just different things that have to happen before we actually get it off the ground. But as we get closer, we may be able to narrow that down a bit.
Thanks, Michelle. Well, thank you all. We appreciate you for joining, and we will talk to you next time. Have a good rest of your day. Bye.